My name is Michael Bates. I'm somewhat of a military brat, but I claim South Boston, Virginia as home. I went to nursing school first prior to medical school, so I took a little bit of a different route. Old Dominion University is where I got my undergraduate degree in nursing. I worked for about 5 years as a critical care nurse, and after that I decided to go back to medical school. I went to medical school at the University of Virginia. After graduating there, I did my residency in Charlotte, North Carolina at Carolina's Medical Center, and later went on to do my fellowship at the Hospital for Special Surgery in Manhattan. So after completing the residency in Charlotte, I did do an additional year at the Hospital for Special Surgery in New York, and that year was exclusively based on hip and knee replacement. The focus there was to actually work on complex hip and knee reconstruction. Lots of these patients were folks that had congenital problems from birth, post-traumatic issues, or many of the patients actually had surgeries done elsewhere that didn't go quite as well as they would have liked, and those were some of the more complicated patients that we took care of. So that year was exclusively for hip and knee replacement. I think having a healthy patient-physician relationship is at the heart of everything we do. I think the biggest thing that we have to do as physicians is ensure that our patients trust us and build a relationship built upon trust. I think this is one of the most intimate things you can do is for a person to give you permission to go in and perform surgery on them while they're asleep. And I think that takes an immense amount of trust. And it's important that you are able to discuss these things frankly with a person that takes what you say and understands that you have their best interests at heart. You can have a dramatic impact on these patients' lives. Hip and knee replacement specifically. You take patients who have trouble doing the most basic things on a daily basis. One of the most common things I hear is I have trouble putting my socks and shoes on, or I can't go up and down stairs, or I can't sleep throughout the night. You can take a person who's very limited by these type of ailments and with the proper surgical technique, drastically improve their quality of life. The caliber of the team here is amazing, and that was a large part of the decision for us to feel comfortable making Greenville home. There's board certified surgeons and most of all the specialties in orthopedic surgery. We have sports medicine, we have trauma, we have shoulder and elbow surgeons here. Myself bringing the hip and knee replacement fellowship training was something that we could add to the community here. Growing up in a small town, South Boston, Virginia, I knew my physician. I would see my physician when I went to Walmart, when I went to the grocery store, which is something that was always very important to me. And they would, if they didn't remember my name, they certainly knew my face and would come and say hello to me. When you're in a much larger city, such as Manhattan, that's something that doesn't really exist. And it was really important for me to get back to that type of medicine. That's what I grew up being comfortable with. And it was important for me to practice in an environment where I felt like I could have that type of relationship with my patients as well.